Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Please do not change the channel because we have a very exciting topic tonight, and that is infertility. This is the second volume in a 3-volume series on infertility. Tonight's focus is going to be the use of acupuncture and traditional Chinese medicine in the treatment of infertility. Our first volume, which is available free of charge at our office in Somerville, is an interview of Drs. Saleh and Dr. DeLugi. These are reproductive endocrinology specialists of the Bedminster Center for Endocrinology and Reproductive Endocrinology in Bedminster, New Jersey. That's available for you if you are attempting to get pregnant as an individual or as a couple, or you also know of people that have had difficulty in becoming pregnant and conceiving. Please take the time out, watch this, and get that information for them. Acupuncture has been in continuous use for approximately 3,000 years. Over the course of the past 500 years, it's been used in China as a treatment for infertility. Now, the gross statistic is this. If a woman's undergoing reproductive endocrinological processes, or IVF, 28 out of 100 women become pregnant per IVF cycle. If a woman undergoes acupuncture at the same time, 42 out of 100 become pregnant per cycle. If a woman comes to our office and receives that, it's an even greater ratio because we focus on that treatment. I've been in practice in Somerville for a 23-year period of time, and increasingly the focus and the core of my practice is on infertility. What they also find is that acupuncture is a process that goes hand in hand with IVF and reproductive services. What happens is that they work independently, meaning a woman can become pregnant through undergoing acupuncture alone. But if they get the acupuncture, it enhances all of those services related with reproductive endocrinology. So it's a win-win. Anyone going should really consider the nature of undergoing this treatment simultaneously. Now, women come to see me at varying states and at varying reasons. It used to be that they would come on their own for acupuncture and Chinese herbal medicine to become pregnant, and that we have our own statistics and ratios just dealing with what those particular problems are or difficulties that the woman is having. If a woman is referred to us either by a gynecologist or by a reproductive specialist, we do not use the Chinese herbal medicine, and we just do acupuncture alone. And the reason for that is that the woman may be on reproductive medications, Clomid, things like this that increase their likelihood for getting pregnant. So we don't want to influence using Chinese herbal medicine those internal chemical factors that may be influenced by the Chinese herbal medicine. So what we do is we just do acupuncture alone. So women come to see me at varying states and at varying times. Sometimes they come on their own. Sometimes they're between an IVF process, meaning, or they've had a failed IVF cycle, and they ask the doctor, what is it that I could do that's potentially going to increase my likelihood for if we do this process again, of becoming pregnant? So this is where acupuncture comes into play. Is every woman a good candidate for acupuncture for infertility? Not necessarily. It's not as if every woman coming into the office is going to make a good candidate. Acupuncture is a tool of balance, and just like there's Western diagnoses for treatment in helping a woman become pregnant, there is also treatment related to certain diagnoses and categories within Chinese medicine. These diagnoses or patterns must be present for us to have something to treat that's going to get the beneficial results that we're looking for. So out of those diagnoses contains the treatment that we need to do at hand. Is acupuncture inherent? Does it have any inherent side effects? The answer to that is no, and that's what's wonderful about it, is that there's no inherent side effects to it, and that makes it a great complementary medicine as well as a medicine in and of itself. How does acupuncture work? Acupuncture works by numerous means. Number one, it's a tool of balance. If a woman has an imbalance of either energy or tightnesses or constrictions or fatigue in their body, acupuncture can determine that. Secondarily, acupuncture increases blood flow to the uterus and to the ovaries. This is where all of the Western-style studies come into play, as they've actually measured an increased blood flow to these regions. And what we find out now is that when you increase the blood flow, you increase the viability and vitality of the involved region. It can change the mucus, it can change the pH, it changes the constitution of how things physiologically interact. So that's important. The other part is that it increases endorphins. Endorphins are a hormone that your body manufactures to promote healing, getting you feeling better and feeling more relaxed. The other thing is that acupuncture is a general relaxing agent. And that general relaxing agent creates a tranquility that gets a lot of abnormal constriction and tension out of the body. And what we find is that when a woman is more relaxed, they're more receptive to becoming pregnant. Stress doesn't just mean tightness and tension. It means a change of our internal environment and chemistries. It changes the acidity in your body. It changes hormones and that deal with stress and the way in which you react to stress in stressful environments. So what happens is that once we bring the body back in balance, frequently what happens is that the woman becomes receptive. There's no official studies that indicate that acupuncture increases egg quality. But after years of practicing that technique, I personally believe that increasing the viability of all of these other factors in the uterus and increasing the blood flow to the ovaries is that you're going to get a more beneficial effect from what is underlyingly your constitution. And they're going to find out more and more about this as time goes on. How long is a treatment? A treatment takes anywhere from 25 minutes initially to 45 minutes in general. How frequently is acupuncture given? Acupuncture is usually, and there's many, depending on the diagnosis, depends on how we go about and how much time we have, how we go about the treatment. But this is the general thing that would just give you an indication of what goes on, is that acupuncture is given usually twice during the course of the first week. It is rendered once a week for a little while, and that depending on how much time before they're going to start reproductive endocrinology. Then, after that, it is rendered 3 days in succession prior to the transfer of the developing ovum back into the woman. So that would be a general case scenario of a woman undergoing IVF processes. If a woman coming in on their own for infertility, there'll only be a structured phase of the treatment, probably for 5 or 6 treatments, till we get the normalcy of their period into place, and then treatment is ranged sporadically over a period of time, and that's more of an interactive process once we determine the underlying constitutional weaknesses that are there. So, as you're going to see in a few minutes, we're going to demonstrate the treatment. We're going to do a traditional workup. Other things that we do is that we teach the women to meditate. We teach them on relaxation techniques. We teach them on dietary well-being. All of these lifestyle components also help to increase peripherally what's going on and what can be changed within the body. Stay tuned, and we'll talk as we work, and it's very interesting.
I can listen. I can cook.
Good. I can coach.
Kids with something to do are less likely to do drugs.
I can drive.
I can paint.
I can dance.
A little of your time can make a lifetime of difference.
I can read.
I can help.
You can help. Call toll-free 1-877-KIDS-313 to find out about community drug prevention programs.
I can keep a kid off drugs.
Welcome back, and I'm going to try to condense the information really quickly. When a person makes an appointment, and usually when a woman calls, I speak to them on the phone ahead of time if they have any particular questions or they're nervous about undergoing acupuncture, which is normally not something that they even considered before it was brought to their attention just how effective it is as a treatment. So I'll usually consult with the woman on the phone, and we'll either give them information. We have additional videos and statistical information available on our efficacy and ratios. Most of the time they just come in, and after talking to me they decide to make an appointment. Now when they come in, they have to plan on about an hour and a half's time in the office, because there's an extensive health questionnaire that's we either send to them or that they fill out ahead of time. And then what we do is we take an extensive history in my office, and I go over the procedures and their underlying history involved. From there, what we do is we go into the examination room, and we're going to do an exam according to Chinese medicine. This deals with the tongue and pulse diagnosis and dealing with hara diagnosis, or the palpation of the abdominal area. There's no internal examination associated with acupuncture for the treatment of infertility. It's not necessary for what we need to do. All of it is in areas of the body that's very comfortable for me to work around in, and there's no sense of being exposed. So what we do is we go into the exam room, and I encourage them that if they don't come with themselves, that they can bring their spouse with them or significant other. They're more than happy to come so that they can share in the information that I give them and get a greater understanding of the process at large. Acupuncture is an extremely effective technique. The whole regime of treatment averages about 1/60th the cost of one singular round of IVF. So it's a tremendous efficacy to increase, almost double the likelihood for success to undergo acupuncture simultaneously, because it just fits into the program so well as far as, you know, being a complementary form of medicine. So from there we go into the exam room, and we're in the studio today, so it's not quite the same as it is in the office, which is set up just to do this work. With us today is Ellen St. Pierre. Ellen, thank you for coming and joining us and being my model for today. Ellen is a Bridgewater resident, and she's a personal trainer. So if either you or anyone you know is interested in needing a personal trainer, Ellen is available, and we'll provide you with a number for her later on. Ellen, thank you for coming. Ellen, by the way, is not interested in becoming pregnant at this time, but has allowed for me to do a little workup on her and demonstrate acupuncture so that you, as the potential patient for this, get a view of some of the processes involved of what's going on. So after the history, we come in. Many times we do Western-style things of taking health vitals. Sometimes it's not necessary because it's not influencing the treatment. We take into consideration medicals or other factors. From there, what we're going to do is a tongue diagnosis. Ellen, let me see your tongue, and stick your tongue out there. Okay. And what we see with Ellen's tongue is it's slightly red at the tip. Sometimes that is an indication of a highly emotional state in the person's life. We see scalped ridges around the tongue. That scalped ridges around the tongue indicate some long-term chronic fatigue that may be going on with the woman. Once again, Ellen has heat signs in the body, which indicates abnormal heat displacement in the body, which means that they're not getting even flow of the heat distribution. And otherwise, she's in great health and great constitution. Next, we're going to do a pulse diagnosis, which is checked on both sides of the body. We have separate information available on this, but in short, we're checking for 27 different qualities about the way that the blood flows over the radial artery. The information that we get from that helps to build the diagnosis in Chinese medicine of what we then need to do as far as rendering the treatment is concerned. Now, what we do after that is that after checking the pulse, which is going to be on both sides, what we're going to do is called a HARA diagnosis. When a person has a heart attack and gets a radiating pain into the arm, it's called a referred pain. When a person gets a gallbladder attack, frequently they'll get mid-spinal pain. It's called a referred pain. Many times, upon palpation, regions of disharmony, meaning regions that aren't well, they're depleted, they're not working right, they're too constricted, they're too relaxed, will give us a reflex tenderness upon palpation. And what we're going to do is we start with certain points, and those points will let us know whether these are points that fit into a traditional Chinese diagnosis and may need to be needled, because there's a lot of abdominal needling associated with acupuncture for infertility. Is that a little sore, a little tender? What I'm feeling that's sore on Ellen today is an adrenal reflex. And adrenals are a very important hormone that deals with the energy of your body. And what we're feeling, too, we're checking to see whether a woman has a lot of, if there's a history of endometriosis, cysts, scar formation. Frequently, they'll be very, very tender in the lower abdominal region from the pubic symphysis to the umbilicus. So we want to know that because acupuncture has a tremendous localized anti-inflammatory response. When we start the needling into the involved regions, your body creates tremendous anti-inflammatories that help to soften areas that have a lot of scar tissue formation in it. The other important aspect that is so critical, and it took me years to really put it into a pattern, and then Western medicine correlated what I was looking for, is that we're actually palpating or feeling for heat in the lower area. What I tell women, what's the secret to a good pizza? And the good secret to a good pizza is a hot oven. So if we have a hot oven, that indicates there's a tremendous amount of blood flow in the involved region, and that's more conducive towards getting pregnant. You'd be surprised when I feel here, in between the upper chest area, in between the xiphoid process and the umbilicus, and down here, what we're looking for is equal heat distribution in these involved areas. Many times they're not, and in women that have problems getting pregnant, it is cold down here. The oven is cold. It is not conducive towards reproduction. We want it hot. And so what we're feeling is surface temperature, and that's going to give us an indication of weaknesses. The other thing that we're going to be palpating is acupuncture points. Is that a little sore, Ellen? And there's roughly about 50 or 60 that we're going to be palpating. How about right there, Ellen? Little, yeah. There's about 50 or 60 in the body that we're going to be palpating that not only give us an indication of whether these points need to be needled according to acupuncture, but it's also going to tell us what particular pattern that the woman fits into, meaning this old thing before of the Chinese diagnosis. When the diagnosis is right and the treatment's right, the results are going to be right. So as I go around, I palpate all regions of the body. There's core points that are related towards reproduction, and we're going to palpate them, check for their reflex tenderness, and get this somatic picture of what's going on. Once we have that somatic picture going on, and she has a frequent diagnosis. It's called constrained liver qi and blood deficiency, and that's one of the more common diagnoses in the treatment of infertility. Others are weaknesses within the kidney channel or the particular meridians of the body. We found that the energy flows in the body into particular channels, and these channels are called meridians. And these meridians have been observed by the Chinese over thousands of years, and we finally found that these meridians are truisms. How they did it, it's miraculous. It is, but it's true. And these particular channels or meridians relate towards certain weaknesses in the body. They call them the kidney channel. It's not that if a person has a weakness in the kidney channel that they have a kidney problem all the time, but those are related frequently towards reproductive problems. So a lot of reflex tendernesses in these regions show up. They found through injecting radioactive isotopes that there's abnormal that the isotopes flow along the course of these meridians. They also find that needling the meridians are points of actual, and acupuncture points are points of lowered electrical resistance within the body being a bioelectrical and biomagnetic channel, that these can be influenced by stimulation, that what's going on inside the body can be influenced by stimulating it from outside. Once we have this traditional diagnosis of evaluation of the Chinese meridians, we're going to do a separate diagnostic pattern of the ears. Now the ears, we have an instrument that will measure hundreds of reflex points within the ears. And these reflex points deal with the external representation of what's going on with the vagus nerve. The vagus nerve is a cranial nerve that influences many of the autonomic or automatic functioning within the body. So if we want to increase the functioning of the thyroid or decrease the functioning of the thyroid, we can actually stimulate these areas doing acupuncture needling and allow for these functions to be changed in the body. We can raise and lower the blood pressure instantaneously using acupuncture by needling within the ear. This is a separate system of acupuncture that was developed by a French doctor, a French medical doctor, in the beginning portion of the century, that has turned into something called auricular medicine. So when a woman comes in, we're going to do acupuncture of the meridians of the body, and then we're going to do auricular medicine of the involved areas. We're going to start that. We're going to start the acupuncture right now, and we'll talk as we go along. Now, acupuncture doesn't hurt. Now, that doesn't mean that certain points aren't tender. Certain points are tender to the needling process. Acupuncture is sometimes it's a little tender, but then a very tranquil sensation comes over the body. You get very, very relaxed. First, we're going to start to needle some points along the kidney meridian. By nourishing the kidney meridian, or these channels down by the ankle, it allows for the body to normalize its flow in that channel. Some of the points most important for the condition are in the extremities, or distal from where the area in question is located. There's nothing in the needles. The needles are single-use, disposable, sterile needles. Depending on the woman and how much acupuncture she's had, depends on the actual number of needles involved in the treatment of the condition. Usually we start out very easily and we do more needling as time goes on. All of the treatment rendered to the women that come in are monitored as they undergo the treatment, and sometimes the needles are stimulated. Sometimes we'll use laser acupuncture for women that are needle shy, but the preferential treatment is to use acupuncture needles. Now these are the needles that are actually helping to increase the blood flow to the uterus, and also it will strengthen her adrenal glands. The effect of an acupuncture treatment within the body can be measured chemically 6 months after a singular treatment, so it's not just effect of lasting right away. Most of the time women feel very, very tranquil right from the get-go of the treatment. But if they didn't, within a few treatments they would feel very tranquil and very, very relaxing. Once a woman becomes pregnant, usually I discontinue acupuncture because we've accomplished our goal. The only times we're going to do acupuncture after a woman becomes pregnant is, number one, if they have a history of miscarriage associated with the reason for not conceiving. Then there's acupuncture treatment for miscarriage. The other thing is that there's acupuncture treatment for dysfunctional morning sickness, and it works extremely well because we do a lot of acupuncture for cancer patients that have a lot of nausea from undergoing chemotherapy. So this treatment is the same treatment for women that have dysfunctional morning sickness. So those would be reasons why we would continue the use of acupuncture after a woman becomes pregnant. Sometimes a woman that comes in to see me, they get so much out of the acupuncture treatment that they want to continue intermittent use of acupuncture because it's done so much for them. Women feel better, they feel more energetic as a result of the treatment, and they're very, very happy that they underwent it, separate from just separate from the core goal of the focus of what brings them to see me, because their overall health is increased from what it was prior to the treatment. Now, the actual numbers of needles involved in the treatment can average anywhere from a dozen to up to 20 or 30 needles for infertility. We gradually work up into it, and don't get disconcerted that the numbers of treatments are alarming, or the numbers of needles are alarming, because it's actually very, very tranquil, and most of the points you hardly feel. The actual needle and the diameter and the gauge of the needle is not like a hypodermic needle. It's very, very fine. It's very, very small. But however, we can create stimulation within those points. These particular points are very, very, very focused for changing certain physiological reactions in the body. The woman will lie, and will lie anywhere from 25 to 45 minutes, usually increasing periods of time. They're very, very tranquil. We put on relaxing music. The environment is very calm and endearing. We also give them things that they can do at home as far as lifestyle applications to increase their overall state of well-being. And the treatment is usually something that they look forward to. When a woman comes in, we tell them not to be in a hurry when they come to see me, because I want them to be relaxed when they come in. I don't want them to be in a hurry. And we're usually like right on time. But there's no, our lives are in such a hectic state that I want them centering on what brought them to see me to begin with, and start this journey inwards that increases the receptiveness within the body. So acupuncture is creating not only functional changes, dealing with areas that are too tight. If there's diaphragmatic constriction, if there's constriction of the muscles and ligaments in the pelvic area, we're releasing that. We're increasing the blood flow into these areas. In and around these needles, you see what looks like a little bee sting or a little welt. That's a favored response. It's a histemic reaction. And that when that goes away, that also gives us an indication of when to take the needles out, which is, it's almost like a recipe, a turkey timer. It comes up and it tells us when the body has reached a maximal reaction that can occur from that region. As it's also good because a woman's libido can also be increased as far as using acupuncture as a treatment, and there's just overall vitality associated with the treatment itself and at large. For Natural Healthcare Alternative, I'm Dr. James Golding, and thank you for watching. And Ellen, thank you for assisting me today.
Thank you for having me.